Okay, so good morning, good afternoon, and good evening to all of you. Thank you so much for taking the time to join us today. Today's session, we are delighted to be joined by colleagues from UNICEF and WHO, who are going to be presenting for us on the newly developed MHPSS Minimum Service Package. We're joined by Vanya, Quiva, and Inka. Just before we get started, I'm going to go through our usual housekeeping. We're not using the webinar setting, we're using the meeting setting today because we hope you'll be able to unmute and ask your questions and have more of a chat after the presentation. So for that reason, we're asking you if you could, during the presentation, just make sure you stay muted. You're very welcome to be on camera if you'd like. We don't have the Q&A function as it's on the meeting setting, but you can add your questions into the chat at any time. We have a colleague here, Ola, who is going to be collecting your questions for the Q&A portion at the end. This session is being recorded and this recording will be made available on the INEE website after the fact and also shared with all the registrants of this session. And finally, we have closed captioning available in English. If you want to enable that, you should be able to go to the bottom of your Zoom window and see the CC closed captioning option. I think that's everything from me. I forgot to introduce myself, but my name is Rachel Smith and I'm the coordinator for psychosocial support and social and emotional learning here at the Interagency Network for Education in Emergencies. So that's all from me just now. I will jump back on at the end to support with the Q&A. So I'll hand over to you now, Vanya.
Thank you, Rachel. Welcome, everyone. Thank you so much for joining us today. We really appreciate having you here. And it's great to see so many familiar faces and names as well. So as you know, we will be walking you through the Mental Health and Psychosocial Support Minimum Service Package, and we will be zooming in on the education components as well. We will then have some time for questions and answers, as Rachel mentioned, but feel free, as she said, to type your questions, your observations into the chat, and we will go through those after our presentation. So before moving ahead, we'll just introduce the MSP team. For those of you who do not know me, my name is Vanya. I work with UNICEF on the development of the Minimum Service Package, mainly focused on the education components of the package, and I will now hand it over to my colleagues Quiva and Inka.
Thank you so much, Vanya, and hello everyone. My name is Inka Weisbecker and I'm a technical officer at WHO. It's really nice to see so many of you joining the session. I'm basically co-leading this project from the WHO side, and I will just get started with providing a bit of an overview of the MSP. So maybe if we go to the slides, we can start with the first slide. Yes. So the MSP project is really a 3-year project that is led by UNICEF and WHO in collaboration with UNHCR and UNFPA. And this project has really come about because of increasing interest in MHPSS by donors, but also across different sectors and areas like in protection and child protection, but also GBV, education, livelihoods. And there's also increased donor interest and political will in this area. We have seen this especially in the last 5 years, and there have been many meetings that have been organized, especially around 3-4 years ago that have taken place in Amsterdam and Berlin, that were organized by the UK government, by the Netherlands, to really try to see how the MHPSS field can be supported, and especially how more can be done in humanitarian settings. So this is basically how the MSP project came about. Is that we have seen a need that has emerged from these meetings, but also from the needs in the field, that there really is still a lot of variation in terms of what MHPSS activities look like in the field, and also how MHPSS is even understood among different actors, among different sectors, among AORs, and that also there's, from a donor perspective, a real need to have a better idea of what MHPSS activity should be prioritized in humanitarian settings. What should be funded first? There are so many needs usually, and donors don't always have technical skills and capacities in MHPSS. So we really needed something that was very practical and could be used by different actors. We can go to the next slide. This project has really grown in scope over time. It started first with funding from the Netherlands government for the areas of health and child protection, because these are where MHPSS is often implemented in humanitarian crises. But of course, there are many more relevant actors and sectors. So we're very happy that then the UK government actually has come on board as a second step to fund the education component of the MSP, which of course, as all of you agree, I'm sure is very, very critical to this. And then most recently, about a year ago, we have received funding as well for general protection and gender-based violence, which is also quite key areas. So we're very happy that actually now the MSP is a much more cross-sectoral product that should also work across different actors, across different sectors, across AORs, as MHPSS should in emergencies. And now I think we can turn over for a short video that explains more about the background of the MSP. If somebody can press play on the next slide. Thank you.
The number of people affected by humanitarian crises is at a record high. Armed conflicts, natural disasters, and public health emergencies like COVID-19 cause widespread suffering and seriously affect people's mental health and psychosocial well-being. Many people affected lose everything they care about: their loved ones, homes and livelihoods, their communities, their sense of place and sense of self. Yet resources for mental health and psychosocial support services are severely lacking. This leaves many people in severe distress and without the care they need. More than 85% of people affected by mental health conditions in humanitarian settings do not receive treatment. Where services do exist, they are often disconnected and inconsistent. Service providers often lack the training and support they need to provide safe and effective services. Humanitarian donors often don't know which MHPSS activities they should fund, and those planning and implementing programs are faced with tough decisions about what to prioritize. The MHPSS Minimum Service Package outlines the minimum MHPSS activities that should be implemented in all emergency settings, across health, protection, and education sectors. The package is based on existing guidelines and extensive consultations with people involved in humanitarian assistance in frontline, regional, and global roles. It is designed to support humanitarian actors to improve coordination between different sectors, identify MHPSS program gaps and priorities, provide timely MHPSS programs based on evidence and guidelines, increase funding allocation for MHPSS, improve coverage of MHPSS activities, and ultimately improve the mental health and psychosocial well-being of people affected by humanitarian crises. The MSP is currently being piloted in Colombia, Iraq, Ukraine, Nigeria, and South Sudan.
I think the MSP in the context of South Sudan will be more than instrumental. The MSP will generate more evidence. Currently in South Sudan, we are in the process of updating the 4Ws assessment to map the MHPSS needs and resources in the country. The MSP will be a great contribution to this exercise. We will understand more in terms of prioritization of needs. We will contribute more effectively to humanitarian needs overview, humanitarian response plan, or humanitarian appeal funds. And also currently we are in the process of developing the National Mental Health Strategic Plan of South Sudan for the upcoming 5 years. The MSP will help us also to understand more what to do and what is working, what is not working.
We in WHO in the Northeast team are very happy that the minimum service package on mental health and psychosocial support is coming on board. And in our context, in the humanitarian setting, this is something which is long overdue. The minimum service package comes at the right time in this COVID pandemic era, when much is needed, because this will set the tone and will make things clear in terms of advocacy, in terms of coordination, in terms of integrating mental health and psychosocial support, in terms of training the frontline health workers, what specific interventions in terms of mental health services that needs to be done. And these guidelines, we are so proud to be part of it. We look forward to use it. Again, this will give the WHO the opportunity to guide partners. As a minimum service package, we believe that this is what the state can use and ensure that all primary health care services are integrated with this. People with gender-based violence who need support, people with all forms of challenges because of the ongoing insurgency of more than 13 years, and it has brought this humanitarian crisis to the people with a lot of stress and challenges. We believe that the minimum service package is the right time.
We are hoping to increase coverage of MSP activities with increased funding in humanitarian settings around the world. We are now seeking feedback from diverse humanitarian actors. You can log in to explore the MSP and let us know your thoughts. With support and collaboration from humanitarian actors around the world, the MSP can play a key role in helping people to recover and rebuild their lives after an emergency.
Great, thank you. I'm glad this seemed to work very smoothly. Sometimes we have issues with the video. I also want to mention there was a question in the chat already about definitions of MHPSS. So I pasted here the one that we use from the ISC guidelines, but we can certainly take some more time in the Q&A session to explain this a bit more. So I just encourage everyone, definitely please paste your questions into the chat so we already have a sense for what we can address in the Q&A. I want to mention now that we actually have the MSP online on MHPSS-MSP.org, and I encourage everybody to log on and register with a simple step and explore the MSP. You can also, once you go online, actually download the PDF of the MSP, which is available also in the different languages, Spanish and Ukrainian. For the time being, we're working on a French PDF version as well at the moment. And the online version is more comprehensive. It really includes everything, like all the resources, the links to the different resources, the appendices and all of that. Well, the PDF version is designed to be a bit shorter without the extensive reference and resource list and appendices, for example, but they might be that might be a good one to, for example, print out or just take if there's limited online connectivity. So we invite you to browse the website of the MSP, and when you register, you will also receive within 1 month a feedback survey where you can let us know what you think about the MSP and how to make it useful to you. So we really encourage everyone to log on, give us feedback. You can fill out the survey, but of course you can also email us at any time. Quiva, Vanya, and myself are really happy to hear from anyone if you want to just give us a feedback per email or even in a discussion. So now I will hand it over to Quiva for the next part. Thank you.
you, Inga. So we can move on to the next slide. Yeah, so I'm going to tell you a little bit about how we have been developing the MSP over 3 years. You can go on to the next one as well, please. Great. So this one is giving an overview of the whole process of developing the MSP. And you can see really the first year of the project focused on the development of the content through literature reviews of key documents in MHPSS, health, education and protection, particularly child protection and gender-based violence literature, as well as broad humanitarian guidance like the Sphere standards. And the literature reviews were followed by lots of consultations through global networks for MHPSS, as well as the relevant clusters and areas of responsibility, and also, of course, organizations like the INEE and the Alliance for Child Protection and Humanitarian Action. So we reached out to lots of different people in these consultations. We had more than 100 participants in interviews and focus groups across diverse locations and roles. And it was really important to us to get input from colleagues implementing MHPSS in different emergency settings, as well as technical advisors based at regional and global levels. So the first draft was developed based on these literature reviews and the consultations, and then it went through multiple rounds of peer review, again with colleagues in different sectors, roles and locations. And now we are very happy to be in the field demonstration phase or pilot phase. And as mentioned in the video we just saw, the piloting really involves inviting colleagues globally to read and use the MSP and provide feedback. And as Inka mentioned, we would be delighted if you would do that too by logging in online, and then you will receive a survey. And then we're also working more intensively with colleagues in 5 specific countries to implement components of the MSP and learn from what it's like to actually roll it out in practice. And then we'll use what we learn in these demonstration countries, as well as the global feedback, to revise the MSP before launching the final version at the end of this year. So we can go to the next slide, please, and the next one. So I'm going to tell you a little bit about the actual content of the package. So it consists of 22 minimum activities, and each activity is coloured with icons, so it's easy to see which sectors are most relevant, whether it's usually a health actor, an education actor, protection actor that typically carries out the activity. And of course, many of the activities are relevant across multiple sectors. And each activity comes with additional materials to support planning and implementation. And we'll speak a little bit more about those later. But as well as the kind of package of materials that comes with each activity, there are 2 additional tools that come with the MSP overall. One is a gap analysis tool, which is designed to help coordinators and implementers identify gaps in minimum activities within a particular region or location or camp, for example, so that they can then work with partners and donors to advocate and fill those gaps. And the second big tool is our costing tool, which is designed to help estimate the cost of the MHPSS response as a whole. So we can go to the next slide, please. So each of the 22 activities they're all organised into 4 different sections, with each section focusing on a slightly different kind of activity. So the first section looks at interagency activities, coordination, interagency assessments, etc. The next section looks at essential aspects of designing effective programmes, no matter what sector you're in, and then of course programmatic activities. And I think the next slide actually gives us a deeper dive into those. Yeah, so you'll see all 22 activities on these slides. I'm just quickly going to describe the sections, but obviously you don't need to worry about reading it all. You can explore the specific activities in your own time, but this is just so that you understand the structure. So like I said, section 1 focuses on interagency coordination and assessment. These are activities that are particularly relevant to technical working groups, coordination groups, clusters, AORs, etc., as they rely on interagency work. And then section 2 lists essential components of all MHPSS programs. So these are activities that any organisation engaging in any type of MHPSS should really be doing. So things like careful programme design, developing systems for monitoring and evaluation, developing systems for staff well-being, and supporting and monitoring staff competencies. And section 3, which is on the right-hand side of the slide there, this lists all of the actual programmatic activities. So this is the main body of the MSP and covers activities from community-wide messaging to supporting community self-help, supporting education personnel, right the way up to focused MHPSS support like psychological interventions, care and protection for people in psychiatric hospitals and other institutions, etc. And then finally, section 4, which we've squeezed onto the bottom left of the slide there, actually focuses on MHPSS activities in specific circumstances. So infectious disease outbreaks and also MHPSS for people deprived of their liberty. Next slide, please. So like I mentioned, each of those 22 activities comes with additional supporting materials. So they start with a brief introduction explaining why the activity is important. There is a checklist of actions to help implement the activity safely and effectively. There are also additional activities for consideration that can be prioritized depending on the context specific needs and available resources. So activities that didn't quite, they weren't agreed by the global consensus as being minimum, but in certain circumstances, they may in fact be very important. So they're there for consideration. Also, key guidelines, standards and tools to support planning and implementation. And finally, a list of budget items for consideration. So this is just a practical tool to help program planners estimate the resources and budget needed to implement the activity. And we'll now show you another short video, which is a tour of the web platform. So you can see how all this looks online, because we know there's quite a lot of different components that I've mentioned there. So this is a video tour to help you know where to find what. And after that, we'll zoom in a little bit more specifically on the education components. So I think the next slide should have the video for us.
The MSP platform is available at MHPSSMSP.org. You can use the buttons on the top right corner of the page to log in or sign up to access the platform. You can also toggle between different languages. Once you log in, you'll see that the platform has 3 main sections: the Home tab, the MSP Guide tab, and the All Activities tab. The Home tab provides a brief overview of the package. The MSP Guide provides a more detailed introduction, explaining what the MSP is, why it's needed, how it can be used, and how it was developed. The guide also includes a section on general principles and considerations that are critical to the safe and effective implementation of the MSP. From the guide menu, you can also download a shorter PDF version of the MSP. The All Activities tab lists the 22 MSP activities. From here, you can click on any activity to access a brief introduction to the activity, a checklist of core actions, additional actions for consideration, and a list of relevant guidelines, standards, and tools. Some activities contain additional information, such as key considerations specific to the activity, and lists of recommended training topics for staff implementing the activity. The MSP platform will continue to be updated with translations and user improvements during the piloting phase. All registered users will receive a survey to provide feedback, which will help us to make the platform as useful as possible.
Great, thank you, Rachel. I think it's Rachel is behind the scenes managing all this for us. So now I'll hand over to Vanya, who's going to speak in a little bit more detail about the education components. Thank you.
Thank you, Inga and Quiva. So now, yes, let's zoom in on the education components of the minimum service package. So as mentioned before, icons are provided alongside each MSP core activity to indicate which sectors or AORs are typically well placed to deliver it. So the education sector is represented by the red icon with a book. Section 1 is focused on interagency coordination and assessment. As we know, effective MHPSS programming requires close coordination among diverse actors across multiple sectors. For example, through the participation and contribution at coordination meetings, by incorporating MHPSS considerations and questions into the planning, design, implementation, and analysis of sector assessment. And this is, of course, applicable as well to the education sector. If we look at section 2, it refers to essential components of all MHPSS programs. So as mentioned before, these are activities that organizations engaging in any type of MHPSS activity should be doing, such as thoughtful program design, developing your M&E system, looking, of course, at staff well-being, and setting up actions to support staff competency. So moving on to the next slide. And here we have just a second, I can get my notes. Here we have the programmatic activities of the MSP. So here we can see that education can also play a role in terms of orienting humanitarian actors and community members on MHPSS and advocating for MHPSS considerations and actions. And I am referring specifically to activity 3.1 on the screen. So this may mean informing actors about the importance of integrating MHPSS in education. Regarding activity 3.2, which is orienting frontline workers and community leaders in basic psychosocial support skills, as we know, teachers and other education personnel are community members to whom people may turn for support. So it is important that they are equipped with basic psychosocial support skills to support people in distress. Now let's look at activity 3.3, disseminating key messages to promote mental health and psychosocial well-being. So learning spaces can unite the wider community and strengthen relational supports. So education settings are ideal for disseminating key messages to help people understand normal and common stress reactions, to communicate an expectancy of resilience, to emphasize culturally and age-appropriate coping mechanisms, to discourage harmful ways of coping, and of course also to share information on how and where one can access MHPSS services and supports. Now, in terms of supporting community-led MHPSS activities, and that is activity 3.4, education actors can also play a role here in supporting pre-existing community initiatives that promote mental health and psychosocial well-being. For example, by helping re-establish youth networks and other interest groups. And it can also play a role in facilitating new community self-help initiatives, for example, peer support networks, discussion groups on specific topics of concern. Now moving on to activity 3.5, which is provide early childhood development activities. Education can play a key part by facilitating learning through play, by creating opportunities for caregivers and young children to interact and play, and also promoting in that way informal parent gatherings, and of course, by disseminating early childhood development messages. Now, activity 3.6, and we're almost there, focuses on providing group activities for children's mental health and psychosocial well-being. Now, as we know, education settings are ideal for structured group activities that help children learn, that help them recover from distressing experience, and also develop their social and emotional skills. And then activity 3.7 speaks about supporting caregivers to promote the mental health and psychosocial well-being of children. Well, this can be done by supporting caregivers to look after their own mental health needs and promoting positive caregiving skills, for example, through orientations and dissemination of materials on caregiver self-care, on positive caregiving, on child development, and supporting children in distress. We will now look at activity 3.8, in which, of course, education plays a major role, and it is about supporting teachers and other education personnel. So this activity refers to making sure that, can we please move on to the next slide? I'm sorry. Here it is. 3.8, support education personnel to promote the mental health and psychosocial well-being of children. So here I was saying that, of course, education plays a major role. And this activity refers specifically to making sure that teachers and other education personnel understand why it is important to integrate MHPSS into education in emergencies, and also understand the role of teachers in crisis contexts. The activity also refers to supporting the well-being of teachers and other education personnel, for example, through peer-to-peer networks, support groups, social and emotional workshops, stress management techniques, whatever is deemed appropriate in the given context. It speaks as well about building the capacity of teachers and other education personnel to support the mental health and psychosocial well-being of children. And finally, it recommends doing so in an ongoing basis. So that is through teacher professional development and support systems, be it through in-service training, mentoring, and/or peer learning methods. You will also notice that the MSP includes MHPSS recommended training topics for education personnel and for workers supporting and building their capacity. And these MHPSS recommended training topics can be found on the website. We will find the link to the training topics on the PDF as well. And I will now hand it over to Inka for an overview of the MSP tools.
Great, thank you, Vanya. So we're almost through our presentation, so feel free to type any questions into the chat, but I just want to mention now 2 tools that we have as part of the MSP. The first one is the gap analysis tool, and on the website you will see there's a tab as well that says gap analysis. And this is basically a tool where you look at all the MSP activities, like you just saw the list, like coordination, assessment, orienting humanitarian actors, and you can pick a specific geographic region, for example, a region in a country that's affected by a humanitarian crisis. And somebody like an MHPSS technical working group who coordinates MHPSS activities could go through this list and actually check to what extent these activities are being implemented. So are they actually being implemented in that region? Are they partially implemented? Like maybe they're just reaching not a lot of population groups, maybe they're limited in geographic scope, or maybe they're not implemented at all. And this gives you just kind of a quick snapshot to what extent the MSP is actually being realized at the field level. And so once somebody puts in this data, which usually would be some sort of coordination group, like an MHPSS technical working group, for example, with input from various different actors, such a printout or graph could be used then to discuss with actors in the country, where are the gaps? What is not being implemented? Where do we need more? And also to communicate gaps to donors to say, look, this activity should be part of the minimum MHPSS MSP, but it's not being implemented. So how can we fundraise for it? How can we do it? So that is that. And we're still actually now, as with the whole MSP, seeking feedback and input about the gap analysis tool and how useful it is and how it can best meet your needs. Now we can go to the next slide, which is the second tool, which is the costing tool. Which is still under development in terms of being finalized over the course of the year. If you go to the costing part of the website, which is under the orientation tab, you will see there are 2 things available. One is a PDF document that basically tells you what things you need to budget for each activity. So for coordination, for example, you need salary for an MHPSS coordinator. Or for different activities, you need technical staff, you need materials, you need equipment. So this PDF sheet will give you some idea of what you need, which could be helpful if you're planning a budget, for example, or if you're discussing with a donor about an activity and how much it will cost. In addition to that, we also have a costing tool in Excel, and there you will actually see that automatically it gives you the cost for specific activities, once you enter some basic information like the country, the number of people affected and things like that, and then it gives you very rough estimates of how much these activities might cost. The costing tool, however, right now is only available specifically for the 5 pilot countries, but if you're interested in using the costing tool, piloting it, giving us feedback on it, please let us know, and we're very happy to send you a copy. It's not available on the website since it's only being tested by a few people at the moment, but we're very happy for anyone who is interested in trying it out. And now I think I'm turning it over to questions and answers. Thank you.
Thank you so much, Vanya, Quiva, and Inka. I've seen this presentation before, but I'm still so impressed by how comprehensive this tool is. And I think, you know, it is a much needed tool in the field. So we had a few questions in the chat earlier, which I think have mostly been answered. Inka, I wonder if you wanted to speak just to the question that came in around the definition of PSS, or how actors are defining MHPSS. I know you posted that in the chat, but it would be great for everybody to hear.
Actually, Inka, would you
Yes.
mind if I build a little bit on your
Yeah,
answer?
I was just going to say that actually, yeah, I would just say what I already posted in the chat, and then actually turn it over to Vanya, who can say more about social emotional learning. But the idea is that MHPSS actually covers everything, and it's a very broad term that's meant to cover all these different areas and things that people do, ranging from clinical mental health treatment to psychosocial activities to awareness raising in the community, so coordination, assessment, so everything that you see in the MSP falls under MHPSS. And there we don't make our own definition, we just use the one in the ISC guidelines, saying MHPSS is used to describe any type of local or outside support that aims to protect or promote psychosocial well-being and or prevent or treat mental disorders. So that's very broad. But now I turn it over to Vanya, because the question also mentioned SEL, for example, and she can talk much more informed about something relevant to education. Over.
Thank you, Inka. So I just wanted to share that in line with the INE guidance, we see SEL as falling under the MHPSS umbrella. That is, SEL being a specific type of MHPSS programming. It is typically a universal MHPSS intervention, as we know it, implemented in formal and non-formal education settings, and more broadly also in other safe spaces. I think Inka has already mentioned that we, in line with the ISE guidelines, the MSP promotes a unified concept of MHPSS, recognizing that mental or psychological health is inextricably linked to the social environment, so that mental well-being and psychosocial well-being are in essence the same thing. And now I'll hand it back to Rachel.
Thank you so much for those clarifications. I just wanted, speaking of clarifications, there was a question in the chat about why did INE develop the minimum service package. I just wanted to clarify that INE is hosting this webinar today and was involved in some early consultations, but this is not an INE product. So any, oh, thanks so much, Natalie. So as we're on the meeting setting and not the webinar setting, I would encourage participants, if they are willing to use the raise hand function and to come off mute and to ask questions directly to our panel. Oh, Inka, go ahead.
Yeah, maybe while people are thinking about questions, I can just say something kind of about the leadership of the MSP, because we get this question also about like, well, whose MSP is it and who's using it and who's using it? So just to say, although it's really led by WHO and UNICEF with UNFPA and UNHCR, we have involved many different actors through the different processes, including the consultation process where INE was already involved, and different CPAOR was involved, GPV actors, health actors, people from the field, people from the regions. So that already happened. as we develop the content, now that we actually have a draft, we again are involving all these different actors in the webinars and dissemination to tell them, look, we have this product now. But thirdly, we now want to actually get feedback. So this is where all of you are, again, really relevant. All of you who are listening, please give us feedback. Please tell us how relevant it is, how feasible, if we're missing anything, if it really reflects your work. This is where we need you, is to make it better now over the course of this year, but ideally now and in the spring. Don't wait too late until summer or fall, because now we're really want to get feedback and want to finalize it. And then maybe to mention, we've also been working with the ISC MHPSS reference group from the beginning very closely, and with their members as well. We'll continue to do those. So although you see these kind of UN agencies on the cover, we're really trying to be as inclusive as possible and want to engage really a wide variety of actors and really want to do it together. Over.
Thank you so much, Inka. Just a question from my side. Have you had any kind of early indications from field testing about how it's been received at the field level? And I'd also be interested to know what kind of different actors are currently field testing the MSP.
Maybe I can jump in on that one. So we have a range of different actors involved in the field testing, a mix of local NGOs, so from quite small organizations to very, very big international NGOs. And also we were very happy that some government agencies have also signed up to partner with our country offices to field test aspects of this. So that includes like social care departments testing some GBV components. So yeah, there's a range of different people involved. We're really just starting with the rollout. We've been handling all the sort of grants management and transfers of funds for all of that sort of thing. So they're just kicking off. A few of them have already started implementing. But yeah, we expect to be getting more feedback over the next kind of 6 months on that. But I mean, initial responses, I think, is it fair to say has been pretty positive. I think people are finding it helpful. I think inevitably, as we go through the field testing, people will also flag additional tools that they need and additional operational guidance that needs to be developed to accompany this. And even as we were developing the MSP, we know that it's not that every possible curriculum is already out there ready to be picked up and used. So we're also trying to, as we go through the field testing, refine more what else do we need to complement this to help people in practice, as well as revising what we've already got. And I might, while I have the floor, I might quickly respond as well to Megumi and I'm sorry if I'm pronouncing that incorrectly, but had asked a question about the different sectors, and then said that we have already answered kind of why education is one of the sectors involved. But just to also add that, I think the MSP focuses on the sectors where MHPSS is already pretty established. So obviously health and protection and education, it's very much growing within education. But there are other sectors that are also relevant. So things like nutrition and other areas of work like peace building, there's more and more MHPSS work being done in those areas. And so we would like for the MSP to be a living document that may well expand and include other sectors in the future. So watch this space, but I don't think the needs are going to stop at any time just because we've finalized the first version of the MSP. So it may continue to grow.
Thank you so much, Quiva. There's a question from Sandrine in the chat. Sandrine, I don't know if you want to unmute and ask the question yourself.
Yeah, thank you very much. It's just a bit of a concern of mine about the qualification usually when we have this kind of project, because not all of us have the expertise inside, or and especially in an inclusive education project, I think we're all aware how much it costs to have technical resources in the project. So just to be clear, because especially with MHPSS, I think I'm really afraid of the do no harm very often. So just wanted to know how within the package you took this into consideration to put warnings, but I don't know, careful, this activity really need to be supervised by a psychologist, for example. Thank you.
Maybe I can answer that. Well, within each MSP activity, you will find a set of core actions, and these actions include the provision of training and the provision of ongoing supervision. We don't indicate specifically what are the required qualifications, namely because we consider that that could be overly prescriptive, in that those might vary according to the context and according to the task at hand. We do provide, however, recommendations in terms of training topics, namely for education actors and for people supporting education actors. So you will have access to a range of training topics that we consider, we and expert consensus consider is advisable for education actors to be trained on in order to support the well-being of children. And that can help in building the curricula and also in looking at competencies that we might need to support as we move on working on the integration of MHPSS in education. And I don't know if my colleagues would like to add something to that.
Yeah, and just to say, we had to find a balance in the MSP between being too prescriptive, but at the same time being clear enough so people know what to do. So we have terms like MHPSS technical specialist with the understanding, for example, that this cannot be a person without any MHPSS background. But of course, people can have many backgrounds: clinical, social work, psychology, psychiatry, and it depends very much on the activity, and even within the activity, what you do. Because say if you treat depression, but only with psychosocial interventions, you don't need a psychiatrist. But if you add medication, then you do. So the guidelines that are linked in the resources section provide more information, actually, often about what kind of professionals you need, because often it is quite nuanced. Yeah, but in general, it gives you an idea.
Thank you so much, Sandrine, for that question. I see some other participants echoing. Rose, you had a question as well linked to this. I don't know if that was answered for you or if you wanted to continue.
Hi, yes, I think Sandrine answered the question that I was trying to say, and I have the same concerns because I've worked with a lot of organizations that profess to be able to do this, and they're sort of self-learned and self-taught. And I come from a government background where you have to have the credentials and the ability to be able to do this kind of work, because you don't want to cause any harm in the process of trying to do good. So I think you've answered it as best you can. And this is really not an INEE issue or a WHO issue. I think it's more of a regulatory issue, and it's not something we can regulate, but it's something that we need to be aware of and sensitive to.
I just wanted to add that we also...
Yeah, maybe you wanted to say the same thing, Vanya, about section 2.
Yeah, go ahead, no worries. I was going to mention that.
Yeah, just to add that actually in section 2, we have a whole heading on staff competencies as well. I think we forgot to mention that just now because we're thinking just about activities, but actually because it applies to all activities. So section 2 has a section on staff competencies, which talks about supervision, checklists to look at competencies and things like that. So it's actually something we take very seriously as well, and try to guide people in the right direction, because exactly what you say, we don't want to do harm because it's such a sensitive area. So we do try to provide the guidance that we think will help, but please take a look and let us know, is this what you're looking for? Is this enough? Does this answer your questions and concerns, or do you need something else? Because the feedback on that will be helpful to us as well.
Yeah, and just to add that within each MHPSS activity within the MSP, we also recommend the engagement of a staff with expertise in MHPSS to oversee the activities with that in mind as well. And over to you, Rachel.
Thank you both. There's a question from Linda in the chat. Linda, did you want to ask your question?
Yeah, thank you. When we talk about experts and having maybe an MHPSS consultant, could you imagine establishing like an expert pool on your page, who to contact? Because sometimes I feel for certain contexts, it's quite hard to find an expert. So yeah.
And maybe I can jump in on that one. It's not something we've actually discussed before, so thank you for the idea. I think there are some existing mechanisms that can be useful. So there is the Dutch surge support mechanism of MHPSS experts already exists, so we wouldn't want to duplicate that, but maybe not everyone is familiar with it. But it is a roster that any interagency group, so a cluster or a MHPSS technical working group in any emergency, can request additional support from this roster by getting in touch with them. I believe that individual agencies cannot request support. It has to be an interagency ask, but an education cluster could certainly get involved. And then there are other networks like MHPSS.net is a big online community where when jobs are posted, a lot of MHPSS people will have access to the ads on there. So that's maybe a half an answer. I don't know if anyone else wants to jump in.
Perfect, thank you.
And I think there was a question on GBV as well.
Yes, that's right. I'm just scrolling back up. Yes, whoever asked that question in the chat, Nalini, do you want to ask your question on GBV?
Sure. Yes, I'm Nalini Chugani with Education Development Center, and I really appreciate this discussion, especially these questions on, credentials and do no harm. I'm just curious if you can share some examples around gender-based violence related to what you've been doing in some of your pilot countries. I'd be really curious to know what specific activities you're looking at and what the feedback you're getting so far is.
Yeah, I think on the pilot countries, I'll turn it over to my UNICEF colleagues because I think there's some work in Iraq, but maybe just to make a quick general point that, yeah, GBV is so important and such an important part of the MSP, and also having UNFPA on board has been really helpful, as well as having Alison Thomas, who's not here on the call today, but she was a consultant by UNHCR who specifically focused on GBV and made sure that it's included. And now we have in the MSP, MHPSS, those safe spaces for women and girls. We also have MHPSS as part of protection case management services, and we have MHPSS as part of clinical care for survivors of sexual and gender-based violence who seek care at healthcare facilities. So we're really trying to get the GBV aspects in the different layers of the MSP. Also very much welcome feedback on that aspect, but maybe, I don't know, Quiva or Vanya, if you want to say something on the field testing. I think there's some work maybe in Iraq. Over.
Yeah, exactly right. So we're partnering with a local NGO called Better World Organization in northern Iraq, and they're working with both Iraqi IDPs but also Syrian refugees. So they're working in camps and I believe in host communities, but doing both child protection and GBV activities from the MSP. So specifically, they are integrating MHPSS into women and girl-friendly spaces, which are run as part of their GBV program. So the specific action, you can have a look at the MSP website. You can also see which activities are flagged with the GBV icon, which I think is our purple one. I'm forgetting because I don't have it in front of me, but yeah, so you can have a look, and the action checklists kind of give you a more concrete idea of what the actual steps are that you would take to integrate MHPSS. But there's a lot around training GBV staff. I think it does also linked to the questions and concerns that are raised about credentials and qualifications. And I think this is a really common concern that we see, particularly in education and child protection, where I think some people feel a bit worried about saying, oh, I'm going to do MHPSS because I'm not a mental health professional. I don't have a degree in psychology or psychiatry. And we've thought about this quite a lot, particularly when we started out on this. And the challenge with saying which particular qualifications is, of course, that we don't have a global registration system, or they're not globally protected terms. So in some countries, anyone with a psychology degree can call themselves a psychologist. Even if their psychology degree maybe had no clinical component, it might have been focused on neuroscience or something very specific. And in other parts of the world, you would have maybe nurses who have extremely knowledgeable on mental health, and other scenarios where doctors have very little training on mental health. So just having a qualification doesn't really necessarily tell you a whole lot. But I think that the point that you need to pay attention to is, okay, the individual that I'm hiring, whatever title they may have, do they have that training? And more importantly, do they have that supervision and an ongoing? Do they have the support for themselves? If they're working with difficult cases, and I think that fear is very, the fear of taking on more than you're able for is very valid, and the concern that people might do that is very valid. But also, it's really important to acknowledge that there is a huge amount that a teacher can do, without, with the right supervision and a little bit of training. Teachers have a wealth of experience already that's very relevant, and maybe there's just a little bit more they need to learn about specific MHPSS techniques they can use, etc. So like you said, it's about not just what you can't do, but what you can do. And we know that a lot of these, it doesn't have to be a really sophisticated, high-level intervention to have a real impact. So that training and supervision piece, I think, is really important.
That's really helpful. Can I ask just a follow-up? You've all mentioned kind of training topics, and now when you're talking about the kinds of training that perhaps teachers would need, do you have training materials that you've used in your pilot that are available for us to see as references, or that you would put into your package as references?
Yep, I can answer, Vanya. I don't know if you want to jump in, but basically every activity has a list of existing materials that are available. We haven't developed them specific for the MSP, but there's quite a lot out there already, and we have just provided links to kind of give a starting point for people. And I think developing more tools is something that hopefully is in the pipeline as well.
Yeah, and also to say, to maybe add that we're actually also looking for where the gaps are, where are more tools needed. So if any of you look at the MSP and the references and you say, well, this is nice, but I really need a tool in XYZ, we would also like to hear about that, because that's a potential additional step for the MSP project, is to look more in detail where gaps are for tools and where maybe more could be done. And sorry, just maybe one quick comment since we're at the end. If you have any technical issues with the website, I think our contact is on the slide, but also maybe somebody can, it's already in the chat as well. So if you have any technical issues or any issues with anything, just send Quiva and myself an email and we get back to you. Yeah.
Okay, wonderful. Thank you so much. Let me just drop the emails in the chat for everybody, but then we will be sending out an email afterwards with your contact details as well, so people can get in touch with you. Thank you all for coming and attending this session, and for your excellent questions and your attention today. And a huge thank you to Vanya, Quiva and Inka for your time. We really appreciate it. It's so important that, all of the work that has gone into developing this package. It's so important that people then actually use it and uptake it, and then it will have the impact. So thank you all for your time. We will send out the recording afterwards for anyone who had to jump off early or who couldn't make it today. You've got the emails of everyone in the chat, but we'll share those out again. And we hope to see you at another INEE web event sometime soon. Thank you very much, everyone.
Thank you.
Thank you for having us. Thank you, everyone.